So today I'm going to be doing an assessment video on my patient here. This is my daughter. Sorry, but this is all I have. My name is Radisha Woodson. I'm a family nurse practitioner student, and I'm going to be doing an assessment video on you today, okay? I'm going to go ahead and start by just washing my hands. Go. This patient is nicely dressed. She's clean. She is conscious, alert, and oriented. She can tell me your name. What's your name?
Mackenzie.
And your date of birth?
December 4th, 2006.
And why are we here today?
To do a physical.
All right, so this patient is conscious, alert, and oriented. The next part of this assessment we're going to go ahead and just check her vital signs. So her mental status is intact. She's well groomed. So we're just going to go ahead and check her vital signs. I'm going to pretend to put the blood pressure cuff on her arm. Checking your blood pressure. All right, the blood pressure reading is going to be 126/78. So that blood pressure is fine. Her weight is 106 pounds, so her weight is fine. Her height is 5'4". No deviations or anything in the blood pressure, so all the vital signs are within normal limits. We're going to check her skin temperature. Her skin is warm and dry. The texture of the skin is very smooth. No lesions noted anywhere. Her skin turgor is very good as well. And then we're going to move on to just checking her head. Any tenderness anywhere?
Mm-hmm.
Okay. The scalp looks good. There's no soft spots in the head, no bruises or anything. So the head exam is fine. The texture of the hair is all good. I don't see any lesions, and she said that there was no tenderness as well in the head. So we're just going to move forward with checking the temporal pulses. Temporal pulses are 2+, and they are strong as well. That part of the exam is good. We're going to go ahead and just check cranial nerves. I'm going to start with the trigeminal nerve. Go ahead and clench your jaw really tight like this. Any tenderness at all? No tenderness? Okay, so no tenderness on that part of the exam. Okay, now make a big smile for me. Okay, we see the patient making a smile. So this is just checking cranial nerves number 7, which is the facial nerves. All right, raise your eyebrows for me. Okay. Puff up your cheeks like a fish. Okay. All right, you can let go of that as well. Facial, I always say there's symmetry, no deviations or anything, and cranial nerves to the face. All right, then we're just going to check the sensory by just doing some touches on the patient to make sure that the sensory is good. Does that feel the same? You feel that equally on both sides? Feel the same? Equally on both sides? All right, so sensory is intact as well. Now we're going to go ahead and just check visual acuity. And we're going to pretend that this is a Snellen's chart, okay? Can you read this line for me? Call out. Go ahead and start reading that line.
A, F, G, L, P, Q.
Okay. Now go ahead and cover one eye for me. Let's start by covering the right eye. Right eye. All right. Read that line for me.
P, 1, 5, 8, 6, 2.
All right. Cover the other eye. Read that line for me.
L, M, Z, Q, X, Y, P.
All right. Great. So vision is 20/20. So vision is fine as well. All right. So we're going to check your peripheral vision this time. Okay. So I'm going to come out of your periphery like such, and I want you to tell me which fingers are wiggling. Okay. Which fingers are wiggling? Okay. Again.
right,
All right.
left, right.
All right. So your peripheral vision is fine. All right. So now we're just gonna check eye movement. All right. So I want you to look up at me. Focus on my nose. All right. Do not move your head and just move your eyes to follow the light. Okay. All right. All right. And then we're just gonna go into more of the eye exam. So I'm gonna just check pupil response. So just look at me. Other side. All right. So there's perla noted in the pupils. They are accommodating to light. All right. So the conjunctiva, the iris, and cornea are clear. No signs of any blood vessel damages or anything. Look up at me. All right. And now we're just gonna go into more of the eye exam to check the red reflexes. So I'm just gonna pretend I'm looking in your eye. All right. So the eye exam, red reflexes and everything are fine and normal. All vesicles and structures, no hemorrhages or anything noted. All right. Now we're just gonna do the whisper test. I'm just gonna stand over to you and I'm gonna whisper something. I just want to make sure you can hear it. Okay.
How are you today?
Okay, that's great. Other side.
What a wonderful day it is.
All right. So whisper test is fine. All right. So I don't have a Weber, the pitch tuning fork. So I am going to check the lateralization of sound, just to make sure that's okay. Just pretend you can hear, okay? Pretend it's a tuning fork. Can you hear that? Can you hear that? All right. All right, we're going to inspect the ear. All right, this ear is fine. There is a large amount of wax buildup in this ear. All right. Tympanic membrane is clear. No signs of erythema or swelling. Same thing here. No swelling, no erythema or anything noted to the tympanic membrane. External ear looks good. All right. Now we're just going to check your the nasal cavity for patency. So just look up for me. All right, so nasal cavity looks patent. There's no swelling or not having any nasal drainage or anything, are you? Now we're just going to go ahead and check the sinuses. First, I'm going to start with the frontal sinus. Is there any tenderness? Ethmoid sinus, any tenderness there? Any tenderness here? All right. All right, stick your tongue out for me. This is just checking doing the oral exam. When you're up, stick your tongue out, say ah. Stick your tongue out. All right, there's some cobblestone noted, but this patient does have a history of a tonsillectomy and an adenoidectomy. Hold your tongue up. Hold your tongue up. Open your mouth. There you go. All right, oral exam looks good. The tongue is midline. There is no sores or anything noted to the tongue. All right, go ahead and swallow for me. Okay. Trachea is midline, no deviations or anything noted in the trachea. Patient's able to swallow fine, stick out the tongue. The tongue is symmetric. All right, we're going to check the carotid arteries. All right, there's 2+ No swelling or anything noted. No tenderness in the neck. Okay. All right. Now I'm just gonna have you just check your neck muscles to make sure they're okay. So turn your head and look over your shoulder that way. All right. Turn your head and look over your shoulder this way. Hold your head, look up at the sky. Turn your head back to the center and look up at the sky. All right. So there's full range of motion noted in the neck. No restrictions or anything. I'm sorry. And look down. All right. You can hold your head up. All right. Now we're just gonna go ahead and check the lymph nodes. Take a deep breath in for me. Okay. All right. All lymph nodes are normal in size. No swelling or anything noted. No tenderness in the lymph nodes. I'm going to check your thyroid gland. Because I can't get behind her. I'm checking it from the front. All right. Thyroid gland is good. All right. Hold your arms up. I'm just going to check your axillary lymph nodes. All right. All those lymph nodes are good. Now we're just going to go ahead into your upper extremities and your shoulders. Lymph nodes were fine. Clavicles and shoulders are symmetric. No deviations noted. All right, I already checked the shoulders, and the clavicle and the scapula all feel normal. Go ahead and hump your shoulders up and pull. There you go. Now you can let down. So she's able to meet resistance and everything with the shoulders. All right, check your elbows. Hold your elbows up like this. All right, elbows are good. You can put your elbows down. Just checking your radial pulses. All right. Normal strength for both radial and brachial pulses are all good. 2+. Hold your arms up like this. We're just going to check the strength of your upper extremities. Hold them up over your head. Put them out in front of you like this. Okay, and bring them out to your sides. All right, you can put them down. So the upper extremity strength is good. All right, so now I'm just going to look at your chest wall. So I'm not going to hold her shirt up during this part of the exam. We're going to pretend that her shirt is up. All right. So there is a bilateral movement of the chest wall that is normal bilaterally. All right. I'm going to go ahead and listen to you. Lungs to make sure, and check your cardiac rhythm as well. First, we're just going to listen to your carotids. Carotid arteries are good. We're going to listen to the apex of your lungs first. Let's take some deep breaths for me. Okay, other side. All right, deep breath. Other side. Okay. Other side. Okay, go ahead. All right, and I'm going to listen to you from the back, so just sit up for me. That's good there. Deep breath. Okay. Again. All right. After listening to the lungs, they are clear on auscultation bilaterally. Okay, now we're just going to check your heart out too. I'm just going to listen to your heart. I'm going to listen in a few places. I'm listening to just breathe regular. Aortic valve is good. Fluid valve is good. The point of maximum impulse is very strong. All right. Now, if you just sit up for me, we're going to check your posterior chest. All right. All right. So all the areas are the sinus is good. Now I'm just going to percuss. So I'm going to tap on you, okay? All right. Percussion is good in all 6 areas as well. All right. We're going to check, we already checked the breathing sounds in the back, so no diminished breathing sounds, no breathing sounds noted on the back of the patient. Now, could you go ahead and just lay down on the chair for me? Lay down on your back, sorry. We're just going to inspect the abdomen. It is flat. No scars. No pulsation noted. No hernia felt anywhere. I'm going to listen to the bowel sounds. There are some hyperactive bowel sounds, but the patient did just finish eating. But other than that, bowel sounds are present in all 4 quadrants. All right, we're going to listen just to check your vascular sounds in your abdomen. We're going to start by listening to the aortic valve. The aorta, sorry. Aortic arteries are good. We're going to check the renal arteries. All right. Renal arteries are good as well. We're going to check your arteries down in the other area. All right, so all those sounds are good as well. We're going to just go ahead and percuss the abdomen in all 4 quadrants. All right, percussion is good. All right, we're going to just percuss the liver, so you're going to feel me press on you, okay? Just checking the liver. All right, percussion on the liver is good. Percuss the spleen. Alright, we're going to do some light palpations in our 4 quadrants. And then that's the light palpation, so you're going to feel me press harder down on your stomach for the hard palpations, okay? Or the deep ones. This one is going to be deeper. So I cannot palpate the spleen, so that's a good sign. I cannot palpate the liver as well. Alright, hold this leg up for me. Bend it. Any pain? Okay. And there's no tenderness or pain there? Okay. So PSOS and ovulatory signs are negative as well. We're going to percuss the urinary bladder. Alright. No tenderness or anything noted. Alright, we're just going to check the hips. No tenderness. Alright, the pelvis, there's no tenderness. Hips feel completely normal bilaterally as well. Alright, we're just going to check your hip range of motion. So bend both knees for me. Alright, we're just going to check the range of motion of your hips, okay? Alright, I'm going to push out and I need you to try to, don't let me push you, okay? Okay. Now open your legs. And I'm going to push in and don't let me push you, okay? Okay. Hold that leg up. Look down. Hold this leg up. And let it down. So there's full range of motion in the hips. Okay, we're just going to assess the ankles and the feet. There's no swelling in the ankles or the feet. All right, you can sit back up. All right, we're just gonna go on down to the foot exam. I'm gonna change the computer so you can